All right, so we continue to talk about all the possible abbreviations you can come across as a um, medical student. And, sorry, I'm just trying to look at this. I'm just trying to see if there's any other color. Okay, fine. So I could choose any color I want here. So as a medical student, there are so many abbreviations in chemical pathology that I can come across, and these are the abbreviations that we're trying to highlight this evening. So the first one which you'll be looking at is what is known as some people call it the 2,3 DPG. Okay, but the full name is 2,3 diphosphoglycerate. So what is it, and what is its relevance? So looking at this, you can actually look at this here. It's a product which is given up. So try to look at the importance of this product. You know, okay. So 2,3 diphosphoglycerate, also known as what 2,3 DPG, or they call it 2,3, okay, biphospho. Di and bi, it still means two. So it's a molecule which is found in red blood cells, okay, and it plays a very important role. It helps to regulate how hemoglobin is releasing oxygen to tissues. Do you understand? This one is deciding how much of oxygen is being released to tissues. So hemoglobin normally binds oxygen tightly in the lungs. So this 2,3-DPG binds to hemoglobin and reduces how hemoglobin loves oxygen. So if the love for hemoglobin, if the hemoglobin love for oxygen reduces, of course oxygen will be released. So this makes hemoglobin more willing to release oxygen to tissues where it is needed. So without it, hemoglobin would hold on to oxygen forever and not release oxygen to us. So you could see it. If oxygen saturation is so much in the tissues, the levels will reduce. If the tissues need more oxygen, the 2,3-DPG will increase so that more oxygen is being released to the tissues. So clinical importance is usually high in all those hypoxic states that the body doesn't have enough of oxygen. Do you understand? And it helps the tissues now to get more oxygen. More oxygen will be released to them. So when it is low, most of the times when the person is under blood transfusion, or some enzyme deficiency or thyroid hormone levels are low. So blood transfusion relevance is if you store blood for a very long time, it loses a lot of its DPG. Do you understand? So even if you come and transfuse the blood later, it will not function very well as of what circulating oxygen, like fresh blood that was gotten and transfused immediately. So what are the conditions that influence it? Anytime you need enough of oxygen, like anemia, you are hypoxic, it level increases so that you can be able to have more oxygen. Then, you know, all those banked blood, metabolic disorders, alkalosis, hypothyroidism can also reduce the levels, which will actually impact how much of oxygen you are getting from the hemoglobin.